What is occupational therapy?
That is a great question. I get that often. I did not myself know what occupational therapy was until I had finished my bachelor's degree. So, occupational therapy is a healthcare profession. We're allied health, and we help people become independent or gain a higher level of independence in doing activities that are important for them every day. And we call those occupations. So that's why it's occupational therapy. We're not career counselors. We help people with whatever tasks they may be struggling with due to an illness, injury. Everything from a person who has a stroke and now has the use of one hand. How are they going to cook a pot of spaghetti and get it over the sink and drain it? How are they going to button a shirt or zip up a jacket or tie their shoes? To some of the psychosocial issues. I've worked with clients where they got fired every 8 months. They couldn't figure out what the problem was. So I was able to work with them to help identify and then make plans for change so they can be independent. And so we as occupational therapists, we help analyze or evaluate what's going on, what are the problem areas in a person's life where they're not as independent as they want to be or need to be. And then we help intervene. And that intervene or that change can be anything from rebuilding skills that they've lost. Okay, muscle got too weak, joint got too tight. So really working on that basic, regaining that skill. Or it can be changing the environment. They can't reach over their head anymore because of injuries. So in the kitchen, moving things out of the top cabinets down to the low cabinets on the counter. So then we've changed the environment. So then they can be independent and do their own cooking. And then we can modify the task. They're not able to open cans, the two-handled can openers. So we, instead of buying canned food, they get frozen food. So therefore we've modified the tasks that they're doing because it's using a microwave and it's opening a plastic bag versus a can. So we help in all areas, people from birth to the end of life.